Hello, I want to talk about a subject related to sexual health because it's very important to have the right information on this matter. Maybe you've heard, just like you can work your arm or leg muscles, you can also, in a sense, train your penis to stay healthier, more responsive, and resilient against age-related problems. This allows you to see sexual health not as a problem, but as a fitness topic you can actively manage. Now, let me explain step by step the scientific basis of this and how you can do it safely. Let's start with the physiology. Inside the penis, there are two spongy tissues called the corpora cavernosa. When sexual arousal occurs, signals from the brain relax the blood vessels and increase blood flow to the penis. This blood fills the corpora cavernosa, causing the penis to enlarge and harden. To maintain the erection, the veins that drain blood from the penis get compressed under a firm layer called the tunica albuginea. This veno-occlusive mechanism keeps the blood inside the penis and produces a strong erection. This process depends on healthy vascular function, good nerve signals, and balanced hormone levels. However, as you age, some changes can occur. After age 40, testosterone levels may drop by about 1% per year. Since testosterone is critical for libido, energy, and muscle mass, this decline can affect erectile function. The corpora cavernosa tissues need to be regularly supplied with oxygenated blood and stretched. If these tissues are not used enough, they may lose elasticity and harden, fibrosis. This makes it harder for the penis to fully expand or to compress veins effectively, leading to weaker erections. ED is usually not a problem on its own. European health authorities see it as an early warning sign of cardiovascular disease. Because the blood vessels that go to the penis are smaller than those going to the heart, vascular damage shows up there first. This is why ED can be a predictor of future serious problems, such as heart attack or stroke. Common causes are generally manageable chronic conditions. High blood pressure damages the endothelium, the inner lining of blood vessels. This lining allows vessels to relax. If it's damaged, blood flow decreases and erections become more difficult. According to the American Hypertension Association, about half of men over 50 have hypertension, which increases the risk of ED as well as stroke or heart failure. High blood sugar causes damage to blood vessels and nerves. This disrupts blood flow to the penis and nerve signals, leading to ED. Diabetes also increases symptoms of benign prostatic hyperplasia, or BPH. Because nerve damage affects the bladder and prostate, according to the Mayo Clinic, men with diabetes may notice ED at earlier ages. High LDL, or bad cholesterol, leads to plaque buildup in arteries, atherosclerosis. This blocks blood flow to the penis. Obesity also contributes to ED by lowering testosterone and triggering chronic inflammation. Now, let's learn what VED is. Like other muscles in the body, penile tissues also need to be regularly supplied with oxygenated blood and stretched. When stress, illness, or aging reduce these opportunities, the vacuum erection device, also known as a penis pump, is an effective tool. The American Urological Association recognizes it as a safe and effective method for ED treatment. VED increases blood flow to the penis, keeping tissues elastic and healthy, preventing fibrosis. Now, let's look at how to use VED safely. First, choose a medically approved device that fits your body and comes with clear instructions. Avoid cheap, low-quality products sold online, as inadequate vacuum limiters can cause harm. Then, trim pubic hair and apply a small amount of water-based lubricant around the base of the device to ensure a seal. Place the penis inside the cylinder and start pumping slowly. The goal is to feel comfortable fullness without pain. Never apply pressure high enough to cause bruising. Once full engorgement is reached, hold for 30 to 60 seconds and then release the vacuum and let the penis rest. Repeat the cycle for 10 minutes. Intermittent repetitions are important, not a single long hold. Do at least 3 sessions a week, which is ideal for maintaining tissue health. Daily use can also be fine if it feels comfortable, but never exceed 10 minutes or more than 2 sessions a day. Overpumping tires the tissue and increases bruising risk. The most important rule: aim for gentle, consistent fullness, rich in oxygen. Soon, I'll give you a simple weekly plan to stop this downward trend. Stay tuned. VED directly supports penile tissue, but the best results come with a healthy lifestyle. Here are my recommendations. 1. The American Heart Association recommends 150 minutes of moderate aerobic exercise per week. Walking, cycling, swimming improves blood flow and supports erectile function. Add strength training twice a week to boost testosterone. 2. Kegel exercises strengthen the pelvic floor muscles. Do 3 sets of 10 to 15 reps daily. Squeeze your muscles as if holding urine for 3 seconds, then relax for 3 seconds. This supports the veno-occlusive mechanism. 3. Follow the Mediterranean diet. Whole grains, vegetables, fruits, olive oil, and omega-3 rich fish. This protects heart and vascular health. 4. Nitric oxide boosting foods. Beets, garlic, spinach, arugula, watermelon, and dark chocolate increase nitric oxide production, which relaxes blood vessels. 5. Avoid excess salt, sugar, and processed foods, which increase the risk of diabetes and hypertension. 6. Regularly monitor blood pressure, blood sugar, and cholesterol levels. 7. Quality sleep is critical for testosterone and hormonal balance. Lack of sleep can increase insulin resistance. 8. Quit smoking and limit alcohol, as both harm vascular health. Every time you achieve an erection, whether naturally or with VED, you oxygenate and keep penile tissues flexible. If these opportunities are reduced, create a program like a workout plan. The key is to prevent problems instead of waiting for them to appear. Here's a simple weekly plan. 3 to 5 days a week, 10-minute VED session. Pump slowly, achieve 30 to 60 seconds of fullness, release, and repeat. 2 to 3 days a week, pelvic floor exercises. Hold each contraction for 3 seconds, then relax for 3 seconds. Most days, 30 minutes of walking. Add strength training twice a week. Every day, eat healthy, drink enough water, and keep chronic conditions under control. If you combine this plan with your lifestyle, you can maintain erectile health for many years. I hope this video has been helpful for you. If you found it useful, don't forget to share it with friends who might need it. Leave a comment, like the video, and subscribe to the channel. See you in the next video. Take care of yourself.